Welcome to the construction industry COVID-19 safety orientation. The coronavirus is a virus that becomes airborne when somebody sneezes or coughs. The coronavirus is known to spread from person to person or by touching contaminated surface and then touching mouth, eyes, or nose with unwashed hands. The way it carries is when someone coughs or sneezes, moisture droplets are formed. The larger droplets drop out of the air soon after coughing or sneezing, but the smaller droplets carry for a long distance. The moisture droplets then land in your eyes or may be inhaled through the mouth or nose. They have been known to be carried into air ducts and ventilation systems, lasting for a long period of times. The coronavirus droplet or the virus has been known to live for 17 days or more. Disinfecting surfaces is important. Hygiene and health.
The virus that causes coronavirus disease is spreading in some of our communities. This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick. Here are some things you should do. Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please call 911. Cover coughs and sneezes with a tissue or the inside of your elbow. Only wear a face mask if you're sick and around other people, or if you need to take care of someone who is sick. Clean and disinfect frequently touched surfaces. Older adults and people who have severe chronic medical conditions like heart or lung disease or diabetes are at higher risk for more serious illness from COVID-19. This group should consult with their healthcare provider about additional steps to stay protected. For more information on COVID-19, please visit cdc.gov/COVID-19. Let's work together to protect ourselves, our families, and our communities.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
If you are coughing, have a fever of 100.4 or higher, or having trouble breathing, please stay home and contact your physician. Follow their instructions and call your work supervisor as soon as possible. Do not return to work until you are released by your doctor to do so. Food and water. Everyone should bring their own lunch. Sharing food, beverages, and/or cooking utensils are not recommended. Water provision. Potable water jugs are not to be used on the work site. Bottles are recommended for workers. It is important you write your name on your water bottle to identify it. Also remember, prevent sitting closer than 6 feet to one another when having lunch. Cleaning and disinfecting are important in stopping the virus. Use the right products depending on the surface you are cleaning. Using the wrong product on a surface may cause damage or discoloring. The coronavirus is known to last for 17 days. Cleaning surfaces is important to prevent others from becoming infected. A bleach solution of 1/3 cup of bleach to 1 gallon of water can be used as a disinfectant. Again, use it properly on the right surfaces. Social distancing is a new word for many, and it basically means giving 6 feet of clearance to the next person, or 6 feet of clearance between people. Whenever having group meetings or job site meetings, group meetings or site meetings should be kept at or under 10 members, and at all times, a minimum distance of 6 feet from one another should be kept. This includes foreman meetings, safety meetings, tailgate meetings, any type of meeting where more than one person is gathered. It's important to remember social distancing. It may prevent someone from becoming infected or becoming ill with the coronavirus. Defeating COVID-19 will depend on how each one of us position ourselves. We have a common enemy. Let us combat together to defeat this virus. Thank you for attending.